Hey Ryan, how's it going?
Good, how are you doing?
Good. My name's Logan. I'm a student physical therapist. I go to UNLV. I'm going to be doing your eval today. Does that sound all right?
Yeah, sounds fine.
Cool. All right. So before we get started, can you confirm your name and your birthday for me?
Yeah, I'm Ryan Richardson, birthday July 21st, 1985.
Nice. Perfect. All right, cool. So I understand you're coming in for some hip pain. How long has that been going on and what's that like?
Well, on my left side, it's been going on for a while. It used to not be so bad. I got an injury while playing football, but I was still able to do more active stuff like CrossFit, hiking, things like that. But it's just been a lot of clicking and popping.
Okay.
Yeah.
Gotcha. And mostly just in that same area that I saw your chart, kind of lateral, but also like the groin area. Is
Yeah,
that where
it's like right here,
Okay.
kind of around and pointing down.
Gotcha.
Yeah.
I'm going to be taking some notes during this, so if it looks like I'm not paying attention, I promise I am.
Okay.
Just want to make sure I get everything 100% accurate. Okay. So I saw on your chart also that your pain is best at like a 2 out of 10, and then usually when it's aggravated at the worst, it's about a 7. Is that right?
Yeah.
Okay. And what kind of activities are making it that 7 out of 10? What's making it worse?
It's a variety of stuff. A lot of the time, if I'm sitting for a long time and then I get up, it'll hurt.
Okay.
If I overdo it in the gym or like if I'm walking for a really long time, then it might start to hurt. Yeah, definitely sitting and like getting up from sitting.
Okay, gotcha. So I saw you're a CrossFit athlete. That's pretty cool. How often a week are you doing that? Are you pretty active still, or?
I try to be, yeah. Lately, the hip has been sort of precluding that, so like I'll try to do stuff at least still 3 times a week, but I avoid going super deep in squats and stuff. So It's a lot of more upper body.
Gotcha. So some of that deep squat is
Yeah.
kind of where it starts to get you. Gotcha. And is that pain, is it sharp? Does it shoot down into the leg or anything, or does it usually just stay in that same area?
Usually just stays right here, doesn't move down the leg. Sometimes it's like mainly dull and achy. Sometimes if it clicks, it might be sharp for a second, but then it goes back to dull.
No numbness or tingling or weird symptoms like that going on?
No, I never had that.
Okay.
Yeah.
All right, gotcha. All right, so I think we kind of got your pain down. I just want to go over some past medical history stuff just to make sure we're covering all of our bases. Understand you're on some medications, mainly for depression, anxiety, and then some of the other stuff is multivitamin, kind of basic stuff. Are you seeing anyone for your mental health stuff? Are you getting checked out for that? Or?
Yeah, I'm staying up to date with that.
Okay.
The meds have been doing a lot. So, yeah, I haven't been seeing a therapist as much lately, but that was secondary to the meds. I've just been feeling better.
Okay,
Yeah.
good. I'm glad to hear that. Awesome. And then other past medical history, I know you mentioned a football injury 16 years ago. Is that pain that you had 16 years ago, if you can remember, I know it's kind of a long time
Yeah.
ago, is that similar to what you're dealing with now?
Kinda, yeah.
Okay.
I would say it's similar. It was probably worse back then. Went away for a while. Now it's creeping back up on me.
Okay, gotcha. Perfect. Saw you work as a realtor. Are you
Yep.
sitting down a lot throughout the day, or are you more on your feet showing houses and stuff?
If I have the chance to, I'm up on my feet. Yeah.
Okay.
I do have to spend a lot of time at the computer, but lately been more on my feet.
Okay, good. Perfect. All right, so I know some of your goals. You obviously want to get back to CrossFit and get into that deep squat without pain.
Yeah.
You want to be able to sit down at work for longer periods of time and not have to worry about that thing acting up on you. So we're going to see what we can do with that. We're going to go through some testing here on the table. I'm going to be probably touching around your hips, back, maybe your legs a little bit. Does that sound okay with you?
Yeah, that's fine.
Cool. So we're going to go through some of that stuff and hopefully we can figure out what's going on.
Okay.
So I'll put my computer right here. First, what we're going to do, and go ahead and stand on up for me. So this is going to be pretty simple. We just call this like a gross movement screen. First thing I'm going to have you do is you can put your hands on your hips, and I just want you to come up like this and see how far you can bring that guy up. Is that okay right there?
Yeah, that's fine.
Is that painful at all?
No.
Okay. Go ahead and bring it back down, and let's try the other leg up. I'm going to come over here. All good still?
Yeah.
Perfect.
This side feels a little bit better.
Feels a little bit better.
Yeah.
Okay, that's good to know. All right. So now what I want you to do is we're just going to swing our leg out to the side here.
Gotcha.
And then I want you to bring it back across the midline.
Okay.
So out and over. Still okay?
Yeah.
All right. Let's try that other side.
Okay. Sorry, I get my balance.
You're good. Any pain with those?
Maybe a tiny bit at the very end, but not a ton.
Okay, gotcha. I'm gonna raise this table up a little bit. We can use it as a little bit of balance support if you need it. I know you're a pretty athletic guy, so I'm just gonna be having you do a back squat here, essentially.
Okay.
So just imagine you're in the CrossFit gym. I know we don't have a bar or anything, but I'm gonna put this here in case you feel like you need it when you get into that deeper position. I just want you can put your hands on your hips or however you like them.
All right.
We're just gonna see a squat.
Okay. I think that's kind of
Painful right
yeah.
there? Okay, gotcha. I'm just gonna make note about that.
Okay.
Not a big deal. All right, good. Okay. So now what I want you to do is we're just gonna touch our toes.
Okay.
Let me know if you're having any pain with that.
No, not as bad as the squat.
Okay. And then we're just gonna go, put your hands on your hips and extend back. Any pain there?
No, it's fine.
Okay. Let's go, and we're gonna rotate this way, and then rotate back the other way. No pain there. Perfect. All right, I love it. Cool. So I'm gonna drop this table back down. And some of these tests might kind of flare that hip up after today. I just want to forewarn you that you may be a little bit more sore. I don't want to make you more sore, but we kind of have to figure out what aggravates this thing, so just a fair warning. Go ahead and sit down for me.
Yeah.
I'll actually drop this even more. This table's interesting. And then you can sit back a little bit further too.
Okay.
There we go. All right, cool. So what I'm gonna have you do is we're just sitting right here. I wanna test some of your strength.
Okay.
So I'm gonna have you lift up this way, and lift up that way for me, just like that.
Yep.
Good there, good there. Okay. So now we're gonna lift up with this one, and I'm gonna try to push that leg back down. I want you to resist it as best you can for me.
Okay.
So go ahead and lift up. Don't let me push your leg down. Good. Let's try on this other side here.
Okay. Oh yeah, sorry.
Nope, you're good. Any pain with that?
A little bit, yeah.
Note that. Good. All right, now I'm gonna raise this back up.
Alright.
All right. So now what I want you to do, just sitting kind of with the feet hanging. Let's do the right side first. I want to see how far you can keep your hips planted. And we're just going to bring that foot out. We call this internal rotation of the hip. Good. And now let's go the other way. Good, just like that. Let's try this on the left side.
Okay.
And good. And out. Looks pretty good. Any pain with that?
Maybe a little bit at the very end.
A
Yeah.
little bit right there. Okay. I'm just going to do this little manual movement here for you. Let me know if we're getting any pain. Is that okay?
That's okay.
How about that?
Yeah, that one I start to feel.
Okay, a little bit of pain.
Yeah.
So now what I'm gonna have you do is we're gonna bring the foot in just like this way again, and I'm gonna push down, and I want you to resist me again.
Okay.
So hold that best you can. Any pain there?
No.
Okay. We'll come back out, we'll do the same thing.
Alright.
All right, gotcha. Make a couple notes here. How's that hip feeling?
Just still doing okay for now.
Okay.
Yeah.
Good. We're gonna do one more test right here. Go ahead and you can just put your hands on your hips, and I want you to extend this leg out and then extend this leg out.
Okay.
Good. Cool. All right, now we're gonna lay down.
Okay. You mind if I take my shoes off?
Yeah, go for it. What I'm gonna do is I'm just gonna check some range of motion stuff. We might do a little bit of strength testing here as well.
Okay.
So I'm I'm just gonna grab this leg. Let me know if any of this is painful. Still okay there?
Yeah, it's not too bad.
Slightly uncomfortable?
Yeah, just uncomfortable.
Okay there?
Yeah.
Alright. I'm gonna cross your leg over here.
Okay.
Just relax for me.
Okay.
Any pain there?
Bit,
A little bit of pain there. Just let me know if you got any pain.
yeah. Yeah, there.
Painful right there.
Yeah.
Yeah.
Right about there.
Okay. Just relax here.
Okay.
Go ahead and I want you to lift your leg up, straight up off the table for me.
Like this.
Yep. Good. And we'll come back down.
Okay.
Let's bend the knee. Good there.
Okay.
Now we're gonna do that same thing. Go ahead and hold your leg right there, and I'm just gonna press into it.
Okay.
Just resist me. Okay there?
Yeah.
All right. Go ahead and relax. Press on your pelvis a little bit here. Any pain?
No.
Okay. Any pain there? I'm gonna write a couple notes down. Alright, good. So go ahead and come up to the edge of the table for me. I'm gonna have you kind of sit like right here. What I want you to do is we're gonna grab this right knee and go ahead and lay down on your back for me.
Okay.
And we're just gonna let this leg kind of actually start up here and then just relax. We're gonna let it come down. Let me know if you're feeling any pain.
No pain.
No pain? Okay. All right, good. Go ahead and sit back up. You just sit at the edge of the table right there.
All right.
Good, good. And then I'll have you lay down here for one more test.
Okay.
Let me know if this is painful at all.
Okay. A little bit right there.
Right here. Alright. Go ahead and lay on your right side. We'll face that way.
Okay.
Just a couple things here. I just want to kind of test a couple different muscles. So I'm gonna grab this guy. You can just relax this leg and straighten out that bottom leg for me. And extend it back this way. Good. Any pain there?
Nope.
How about that?
Tiny bit.
Still up in that front
Yeah, like
part
the
of the
front.
groin.
Yeah.
I'll just have you kind of sit like that, relax. I'm just gonna do a little touching here.
Okay.
Let me know if there's any tender points.
Okay.
Is that okay?
Yeah, it's okay.
So I know you were saying you did have a little bit of lateral pain or pain on the outside of the hip here. Is that replicated or is that still okay?
A little bit.
How about that up there?
A little bit more.
Go ahead and lay on your stomach for me. I'm going to take out the face part of this so you can put your face in there. Just relax. Let me know if this is painful at all. Still okay?
Yeah, no pain.
All right. So I'm going to pick your leg up. Is that all right?
Yeah. It's
I'm going to do the same thing. Just put a little pressure here. Is that okay?
Yes.
All right. I'm going to make a note real quick. You can just stay just like that.
Okay.
Okay, so now what I want you to do, just how I lifted your leg up, I want you to do that same thing, just you providing the force this time.
Okay.
Is that okay?
Yeah.
All right, so now go ahead and relax for me. We're gonna do that same thing and I'm gonna push down against it. I want you to resist it as best you can.
Okay.
So go ahead and lift up for me. Hold against that. All right, good. All right, go ahead and sit up for me and we can just sit on the edge of the table right here. We're gonna go over some of your results.
Okay.
How we feeling? Is the hip bothered at all or? Doing
Not
okay?
too much more than usual. Just a little bit, yeah.
All right, gotcha. So, a little bit of weakness going on in the hip. Obviously some painful stuff. You were able to replicate your pain and some of the similar areas that you were having. Some of the areas were also kind of bugging it. So essentially what I think is going on, or what I would say my diagnosis is probably something to do with that labrum. Maybe some of that labrum is, frayed a little bit or something's going on there. Could just be some inflammation. But since you've been dealing with this for a little bit longer period, I would assume that there might be some structural damage in that labrum. Not saying it's super bad, but it's causing you some pain, so it's definitely something we want to address. Considering you had the football injury years ago, it might just be something that's related to that, and degenerative changes happen all the time, right? Our bodies aren't going to last forever, unfortunately, so, but it is something that we can improve. So I think with physical therapy, we can definitely get this better. We have some things that we can do to make the muscles around your hip stronger. And then I think what I want to do is get that thing imaged. I know you had some imaging in the past, but I think it'd be good to get some current imaging. And then that way we have a really good idea of what's going on. So I would boil it down to maybe something that's kind of torn in there. Torn's a scary word, but I don't think it's super bad. And then, or something's just getting pinched. So it could be an impingement of some sort. We can't really tell right now, we just know something's going on. So we're gonna do some exercises, hopefully make you feel a little bit better. Try to move your hip joint a little bit and maybe calm the pain down.
Okay.
And then get some imaging and then try to go from there. Sound good?
Yeah.
Any questions?
Yeah, should I back off my activities at all for now, or like the way I've already backed them off, is that enough?
Yeah, so I would stay away from the deep squats for now,
Okay.
Especially if that's the thing that's flaring you up. It's hard to play this game where we kind of flare it up and then back off, flare it up and back off. Let's just try to tone it down for right now and see if the body will kind of calm down, and then see what we can do going forward. Maybe build you back up into some of those positions that make it a little angry.
Okay.
Does that sound okay?
Yeah.
All right. And then we'll talk about some exercises that you can do in the meantime. I know you don't want to lose your fitness.
Yeah.
I'm an athlete too, I get it. I don't want to be out of shape, so we just got to work around the injuries for right now and let the body heal. So, sound good?
Yeah,
Cool.
sounds good.
All right. Thanks,
Thanks.
Ryan.